Hi, my name is Fahim, and I'm going to be demonstrating of how to inject a IM injection to an infant or a child. First, I'm going to come over here and wash my hands, perform some hand hygiene. Next, I'm going to arrange the right supplies. So I'm going to grab some gauze, 2x2. I'm going to grab the alcohol prep pad, the isopropyl alcohol, 70%. I'm going to look for the right syringe and the needle. So I'm looking for the 1 ml, 25 gauge with the 5/8 inch. The right one. Sometimes you want to label the if you have multiple medications, just to make sure you don't mix them up. But I don't need to do that in this case because it's only one medication. Alright, so I got all that ready. So now I'm going to go over and look at my MAR. Okay, so it wants the Hep B for Carlos Caliente. I'm going to come over here, find the right medication. The Hep B, it wants 0.5 mLs. Alright. The Hep B, so it has 0.5 mLs. I'm going to put it down. And now I'm going to compare the medication with the MAR, which is going to be my first check. So the right name, Carlos Caliente. The right medication, Hep B. The right dose, 0.5 mLs. The right route is IM. The right time is now, which is 9 a.m. The right route, I said earlier, IM. Expiration date. Okay, it's March 25th, 2014, so it's up to date. And I'm noting the lot number and the manufacturer number just to, for documentation later. That's the first check. And now once I put it down, I'm going to do it again, just to make sure. First name Carlos Caliente, Carlos, last name Caliente. The medications Hep B. The right dose, 0.5 mLs, 0.5 mLs. The right route, IM. And it's only given today, right now, 9 a.m., which is the right time. And that's going to be in the vastus lateralis. Got that down. So now I'm going to come over here. I'm going to clean off my... I uncapped it already, so now I'm going to clean it off. Okay, I'm going to take my 1 ml needle. Uncap it. I'm going to withdraw 0.5 liters of air, mLs of air. Being careful not to touch the bevel. Okay, 0.5. I'm going to inject. Draw it in there. 0.5. Tap any air bubbles out of there. Okay. Perfect. And now I'm going to safety lock it. Okay, so that's prepared. All my materials are prepared. Now, before I put this back in, I'm going to do my third check. So I'm going to do the Hep B. So the right name, Carlos Caliente. The right med, Hep B. The right dose is 0.5 mLs. The right route is IM, and the site's going to be the vastus lateralis. The right time is 9 a.m. And the reason I'm giving it is to prevent Hep B virus, but I usually do the right reason at the bedside with the parent. And that's pretty much, and obviously, again, the lot number I'm going to note, and the manufacturer number for when I document. Okay. Alright, so now I put it back in the fridge. And I might have not mentioned earlier, but I did warm it up, just to, because that's what you have to do when it's refrigerated. And yep, so now that's pretty much, you lock the cart. That's it. Knock, knock. How you doing today?
I'm good.
And what is your name?
Charlene Caliente.
I'm Fahim. I'm a student nurse, and I'm going to be injecting Hep B to your baby today.
Okay.
So I'm just going to perform some hand hygiene real quick. Alrighty, so I just need to identify the baby. Okay? So can I get the baby's name, please?
Carlos Caliente.
Okay. And date of birth?
2/25/2014.
Perfect, thank you. Alrighty. Okay, now I'm going to inject it into the baby's leg, which is also called the vastus lateralis. Alright. Alright, so wash my hands already. Okay. I'm going to find the landmarks first before I start anything. So it's usually right between like the knee and the hip. It's like on the outer, a little more in the outer portion. If the baby's too thin, I might want to pinch the skin a little bit to get the fat. First I'm going to clean off the area. From inside to outside. Okay. Then I'm going to hold on to the gauze to wipe it after. I want to let it dry a little bit first real quick. I'm going to uncap the syringe. Hold it between the thumb and index finger. As like a dart, and it's going to go in 90 degrees. So I'm going to hold it. I'm going to inject. Keep it steady. Inject slowly. You do not need to aspirate for vaccines. Pull out real quick. Apply gentle pressure, but no rubbing or none of that stuff. Cap the syringe. Put it into the sharps. Remove the gloves. Throw it in the trash. Alrighty, wash my hands. Alrighty, now I'm going to, I'll be back in 20 minutes to make sure there's no adverse effects, you know, like no inflammation, redness, none of that stuff. But the baby might, it might have some nausea, diarrhea, vomiting, little fever. It's usually common. So, it happens. That's a slight side effect. So I'll be back in like 15, 20 minutes to check up on the baby. Alrighty? Alright. And now I'm going to leave the room. I'm going to document, which is the eighth patient, right? You know. So when I document, I'm going to document the medication, the name of the patient, obviously, the date, time, the route, which is IM, the site, vastus lateralis, any side effects I noticed too afterwards, and then obviously the lot and expiration, the lot number and the expiration number, and the manufacturer number too. Alrighty, thank you.